I'm Dr. Sharan Shivraj Patil, Chairman and Chief of Orthopedic Surgery, Sparsh Group of Hospitals. A country like ours in India, private sector is a very important sector and plays a major role in healthcare. The only important thing is to define what is the role of private healthcare becomes paramount for predictability and how best the resources are used. PPP model, which has been advocated a lot in our country, is essential for a complete delivery of healthcare. But within that, again, in the PPP, the agility with which the decisions are made and how we go about defining the role of the government, the role of the private sector, and how best we can put all these together and synthesize a best outcome scenario becomes very important, and the devil lies in the details. We are a great nation, and our nature by and large suits the medical profession, is my belief. We produce probably the largest number of doctors and nurses and paramedical staff in our country. And we could be essentially an epicenter of great medical care. Knowledge is free flowing, and even if you are in any part of the West, you'll invariably find an Indian giving you the health care. So why can't we become the focus and attract and be a destination for medical tourism for so much of the world which does not have state-of-the-art healthcare? Government plays a major role in medical tourism because the policies have to be very clear. We need to facilitate people to come here and have a very transparent way of getting treated in our country. And they need to know the facilities, the way to go about, and right from getting the visas to getting the medical care done, it's a very important roadmap which needs to be put through to encourage this aspect of the medical profession. And I feel that digitalization and COVID times, our abilities, what we have learned how to deal with patients remotely is remarkably improved. So we can see these patients remotely, advise them, and they come here only for the procedures, and they go back and get followed up in their own country for the follow-up. And this could mean a whole shift in the way we look at medical tourism in our country. Medical profession is still a very big mystery, I would say. We need to demystify this. The connect between the people and the doctors and the profession needs to be far stronger. There has to be a way of taking away that God complex and making this more real, more accessible, and the transparency is so important. For this whole lot of reasons, as doctors and as professionals, we need to communicate that much more with the community, and there needs to be a lot of bridges built so that we understand and deliver what is real and what is imagination. Medical science has always been through technology. We understand human body better, we diagnose better, we treat better because of technology. And the technology, what is going to help us become more precise as a profession. At Sparsh, we embrace this wholeheartedly. We're always looking at optimizing technology to reach more people, to make it more cost-effective, and to give that advanced treatment options to our people. Today, we do remote consultations. People don't have to travel. We use robotics. We use what's called an O-arm. We use very specialized microscopes. And the kind of technology intervention which is making Sparsh really give the best of medical care to more number of people is amazing. We are able to have a combined wisdom of multiple doctors across the globe in difficult situations with the help of technology and gets the best solutions for the people. And this is something we are very proud at Sparsh, and every Sparshian, every doctor at Sparsh has embraced technology as their own. Sparsh Hospital is 16 years old now. We started as an orthopedic practice. Now we are into all super specialties, right from bone marrow transplant to organ transplant to complex interventions in orthopedics, use of technology. All this has been a milestone after milestone what we have achieved. In Bangalore, we have close to 1,000 beds now. And these are very collaborative. We have multiple units, and each unit specializes in something spectacular, and we work as teams. And I really think the teamwork is what defines Sparsh, because many problems require multiple specialty interventions together, and this is where our doctors, our technicians, and our nurses become egoless, merge together, and deliver what is best for the patient. The philosophy of Sparsh is mainly we want to be relevant to the community we live in. Whatever we do should be the answers to the problems the medical science is thrown at by the community and the people we face, may it be COVID or the accidents or whatever are our challenges or what we like to meet. And we completely rely on feedback to understand the needs of what needs to be delivered. And that is our philosophy. And one thing what we promise to everybody who comes at Sparsh is they come with the faith, and we will keep their faith, and the hope is what we think we will give each one of them. And to do all this with tremendous amount of love and empathy is the core value for which Sparsh stands for. The way we are looking at how we go in the future is we are very strong at the core. Our philosophy remains the centricity of patient as everything we do for, and we are looking at expanding in the city of Bangalore and in the south of India in the next 3 to 5 years' time, extensively enough to have the scale to deliver consistent quality care to the people. And we see technology as a very important part of how we can reach out and service more people.